Very good morning, dear friends. After a long break, we're going to learn one remedy from fourth year syllabus and very useful in day-to-day homeopathic practice. That is Uranium Nitricum. We'll discuss it from Boericke's Materia. I will tell you, or I will, in brief, I will explain you that how I used to use this remedy. This remedy is a wonderful remedy in cases where diabetes is associated with its complications. Diabetes with hypertension, diabetes with nephrotoxicity, with renal hypertension, diabetes with nephrotic syndrome, diabetes with kidney failure. A wonderful remedy to be utilized in such types of complicated cases of diabetes. Generally, this remedy is not used in high potency. It is used in generally 3x, 4x potency. And it works beautifully in many cases to reverse the complications of diabetes. So, this theme one should not forget. Second thing, you open your Boericke's Materia Medica. You'll find, we'll learn it by sentence because it has a significant meaning. So, uranium nitricum, it is the nitrate of uranium. Uranium is a radioactive substance. So all radioactive substances have a higher atomic weights and they are more destructive. They are always self-destructive. In the similar manner, uranium nitricum is the remedy which is useful in destructive processes. So it is antisyphilitic remedy. Uranium nitricum causes glycosuria and increased urine. It is known to be produce nephritis, diabetes, degeneration of the liver, high blood pressure, and dropsy. So first sentence itself defines the whole action of the uranium nitricum. That's diabetes with nephritis, diabetes with hypertension, diabetes with liver complications, all things which covers over there. Dropsy, it is secondary to kidney failure. Its therapeutic keynote is great emaciation, the debility and tendency to ascites as well as general dropsy. So this tendency is very much marked. Kidney failure with lot of ascites, liver affections with lot of ascites, and at the same time there is a tremendous emaciation and debility. Day by day patient goes on getting reduced weight. Backache and delayed menses, dry mucous membrane and skin. Head symptoms. Patients are ill-tempered. Ill-tempered means they are not in normal pace. They get irritated on slightest things. They becomes angry on very small things. Very ill-tempered, very easily gets disturbed. Dull, heavy pain in head. Nostrils sore with purulent and acrid discharge. So nostrils are generally, they are acrid, because of acridity, they are sore, painful, and there is purulent discharge from the nose. Mental depression, and this depression is secondary to the diseases. So complications of diabetes leads patient to a miserable state, and that depression you can find it out with this specific remedy. Eyes, there is a lids are inflamed and agglutinated. The styes, you when styes are there and when recurrent styes are there, you always think about the staphysagree as the first remedy when it happens up one after another. Stomach, excessive thirst and nausea and vomiting. Ravenous appetite, eating followed by the flatulence. Boring pain in pyloric region. Very, whatever is given in italics in Boericke's Materia Medica has a significance. It has a pain in nearly about epigastric to umbilical, in between area you used to get pain in these patients. This is the remedy for gastric and duodenal ulcers. Peptic ulcers. Ulcers very typical of syphilitic myasm. So it is close to calibichromicum in this sense. Burning pain, abdomen is bloated, so fullness in abdomen after eating. Gas second to lycopodium. So see how much flatulence is there second to lycopodium. Very important theme mentioned by the Boericke. That flatulent remedy, one of the top remedy is always a lycopodium, where the flatulence generally happens to be in lower part of the abdomen. Here it is whole abdomen is flatulent, and this is one very important remedy. So ulcerations, gastric ulcer, duodenal ulcer, very important remedy for that. Urinary symptoms, copious urination because of diabetes, diuresis, incontinence of urines, diabetes, emaciation and tympanitis, bursting, burning pain in urethra with every very acid urine. So strong urination sometimes with severe burning, acrid urine, and it is too burning, unable to retain urine without pain, and there is enuresis. Another remedy which is mentioned in bracket is mullein oil. Yes, mullein oil is nothing but the verbascum, very useful. I have utilized it many times in bedwetting cases. 5 drops in a water 3 times a day. It helps a lot in bedwetting cases. So see, this remedy has significant action on abdomen where liver is at fault and there are peptic ulcers. Then this remedy is also having very specific action on urinary complaints, and where diuresis are all typical features of diabetes, the polyuria, frequent micturition, sometimes it is very strong acrid urine, and diuresis, incontinence, all those features are there. In male genitalia, complete impotency. And this impotency is related with the diabetes again a complication of diabetes. Complete impotency with nocturnal emissions. Organs are cold, relaxed, and sweaty. So there is a nocturnal emission without an erection. Very important feature which you can get in this specific remedy. And this is again a secondary complication of the diabetes mellitus. See, in one short sentence, when you get a case where diabetes is associated with nephropathy, diabetes is associated with hypertension, diabetes is associated with ascites, diabetes is associated with liver disorders, and diabetes is associated with impotency. When all these complications are there, you must think about the uranium nitricum. My suggestion always I used to use 3x to or 4x potency of uranium nitricum in repeated doses. It requires a repetition. Relationship, compare the Syzygium jambolium, phosphoric acid, lactic acid, argentum nitricum, calibicromicum, arsenic, and fluoridazine. Fluoridazine is the active principle, but I have not utilized that remedy, so I will not comment on that specific fluoridazine. But rest of the remedies we know Syzygium is very specific for diabetes, but complications are not covered with Syzygium. Phosphoric acid is very close to it because debilitated phosphorus with a diabetes insipidus and impotency. Very important remedy. Lactic acid, again, very specific remedy for diabetes, polyuria, polydipsia. Argentum nitricum, calibicromicum, stomach symptoms very closely associated with that. Arsenic is also one of the important remedy in diabetes associated with weakness. Then dose which he has mentioned is second trituration. I used to suggest 3x or 4x because these are most common potencies which are available in the market, and I'm using that. So, and in the repeated doses, one must use the uranium nitricum. So, uranium nitricum, always think about all those things which we have discussed. Is it clear? So that we have finished one more very important remedy from your syllabus, uranium nitricum. Never forget it in diabetes and its complications. Thank you.